Hello, everyone, and welcome to today's industry webinar, Provider Relief Fund Expansion on the Accelerated and Advanced Payments Program. My name is Ellen Knowles, and I am the Marketing Communications Manager at Azalea Health, and I will serve as your moderator for today's presentation. Before we get started, I'd like to go over a few items so you know how to participate in today's event. Everyone on this call is listening in using their computer audio system by default. And if you would prefer to join over the phone, just select telephone in the audio pane on the right-hand side of your screen, and the dial-in information will be displayed there. With all the ongoing changes during the daily fight against COVID-19, our goal is to give you all the opportunity to get your questions answered. So we really want to have an interactive Q&A session during today's presentation. So please take a moment to submit your questions by typing into the questions pane on the control panel. You can send in your questions at any time and we will address them at the end. Also, please note that today's slides will be shared in a follow-up email along with the webinar recording in case you want to review again or share with any of your peers. I would now like to introduce our presenter today. We have Margaret Chandler, Azalea's Clinical Regulatory Consultant. With that, I'll go ahead and turn it over to you, Margaret.
Thanks, Ellen. Welcome, everyone, and thank you for joining. I just wanted to kind of answer some questions that people have been asking me and see what other questions are out there that people haven't asked, but that would be helpful for everyone to know. So just so you know, my job at Azalea Health is just to keep up with all the regulatory stuff that relates to our both ambulatory and hospital clients, how it relates out in the world, in your world, and then also how it relates back to our applications. So we're not going to really get into any Azalea specific things today because, obviously this program is not, it's vendor neutral. It doesn't matter what kind of EHR you have. But we did want to get the word out because of the changes from the accelerated program to the refund program. And so I just have a few slides, just I think about 3 or 4, and I'm just using those to kind of hit the high points, and then we can jump into whatever questions you all submit. So if that's okay with everybody, we'll just move on. So the first one is, why should you care about this expanded or most recent update? And there are 2 really big points that I'd like to make for you. The first is that the first accelerated advance payment program was a loan, and you would have to repay that. But now this new one, the expansion of that, is not a loan, and it does not have to be repaid if you meet the terms and conditions. So to me, that's a huge significant difference. What we're talking about here is the $100 billion that Congress appropriated to reimburse providers for lost revenues and increased expenses due to the COVID pandemic. This originally, the funds were being distributed by HRSA, the Health Resources Service Administration, and now with this new provider relief fund, the ones that don't have to be repaid, those are being dispersed by and managed by the MACs. So that's a pretty big change as well. Each MAC will have their own rules and hoops you have to jump through. The other piece of this that I think is super important is that even if you already got money from this accelerated or advanced payment program, you are encouraged to request additional funds through the Provider Relief Fund. So you can double dip and are encouraged by the government to double dip. So there again, I think that's a pretty big, important thing. Moving on to the next slide. What has been added is there was originally $50 billion allocated to the general distribution, and 30 of that has been distributed. There's $20 billion left, And that's what this provider relief fund is wanting to give to you, really wants to distribute. So what do you need to do to get that? So there's kind of three categories of providers. The first category I'm going to talk about is if you have already received a payment related to the accelerated payment program, then you just need to go to the link that we have at the end of the slides to submit data about your annual revenues and estimated COVID-related losses. And then that it's not really even an application. You just attest that these are accurate numbers related to COVID and that you agree to the terms and conditions. And then you automatically will get additional money. Now, if you have not received any payment from the fund, don't go to the general distribution portal or where we sent you 2 weeks ago to get to apply to get some of this money. Do not go there. That you'll just be wasting your time and you'll get turned down. But you go to the same place, the Provider Relief Fund, and that's how you get distributed funds from another distribution from the max, or it's through the max. It's from the same place, but through the max. Now, the third category is providers who have not received anything from anywhere. You still go to that same provider relief fund. So the bottom line is, no matter if you've received some, if you've not received any, wherever you've applied, as long as it hasn't been the provider relief fund, then you need to go apply again, or attest is what they're calling it, attest to the terms and conditions. So that's there's been a lot of confusion around that. So please, let us know if you have questions about that. I'm kind of expecting questions about that. So the next one, this is our links, the link pages. And I wanted to point out what I was just talking about. It's this link right here, the CARES Act Provider Relief Fund. That's where you go to apply for the additional money, or if you haven't gotten any already, to get some. That's just a link, and it's like doing your taxes. It asks you questions, and you go to the next page, and it asks you more questions, and then you attest and say, yes, I agree to these terms and conditions. So that's really all that I had for the presentation, because we wanted to make sure we have plenty of time for your questions and any discussion that you'd like to have. So do we have anything yet, Ellen?
Yeah, we do. Thank you, Margaret. We are now going to begin answering questions submitted during today's presentation. And as a reminder, you can still submit your questions in the attendee control panel. So our first question asks, what are the rules for use of the money? Will we have to pay it back?
So the original money that came from what they called the accelerated payment plan, you will have to pay that back. But the second round of funding, if you meet the criteria and you agree to the terms and conditions, you will not have to pay that back.
Okay. All right. So there's two different programs there.
Right.
All right. And we have another question that asks here, if we are fee-for-service, are we allowed to charge patients for after COVID checkups or anything COVID, or only take their insurance? Not sure if that, let me know if that makes sense. So if they're a fee-for-service, are we allowed to charge patients for an after COVID checkup, anything COVID related, or only take their insurance?
Okay, so we are speaking fee-for-service for Medicare. I can't speak to other payers or cash, but for Medicare beneficiaries, as long as you're using the COVID approved CPTs, then it doesn't matter at the timing of it. So do
Mhm.
you have those COVID CPTs, or is that a link that you would like for us to send to you?
Okay,
You can
we
just
can
put that in the
follow up
chat.
with.
Yeah.
Yeah, we can follow up with her. That was Lynn. We will follow up with her separately on that one.
And
Oh, go
Ellen,
ahead.
just for your notes, that would be an RCM, Doug, Sherry, Sarah
Sure.
question.
Okay, sure. We'll do that following this. The another question here. So the second payment of the HRSA were released on April 24th. Do we have to apply to get them?
No, you do not have to apply. It's my understanding that they will send you the money automatically, but you have to go out to this website here, the Provider Relief Fund, and complete the attestation saying that you know that you won't have to pay this back, and that it's only going to be for COVID and that kind of thing.
Okay, so everyone, when we send the follow-up email after the webinar today, you will have a copy of the presentation and you'll have access to all of these links here. So make sure you visit those. All right, our next question, just for clarification, someone wants to know how many programs are there exactly?
How many programs are there for COVID and financial assistance to providers?
Correct.
That's what I'm thinking the question is.
The financial relief programs, yes.
So the only ones that I'm able to address and are aware of that is provider centric is this original accelerated payment program and the provider relief fund. Now there are other business type programs like the employment program, things like that, SBA loans and those kinds of things. That is not in my area of expertise. So provider centric, there's just this one or two, depending on if you count it as one or two. It really is one program with two different distribution types and time frames.
Okay, thank you for that. Medicaid only providers, how do we attest?
Medicaid only, I don't know the answer to that, but I will find out and we'll include it in our when we send out our question or our presentation.
Okay, we'll follow up with that one. Let's see. What are the rules related to SBA PPP forgiveness?
So SBA, that program is out of my wheelhouse, if you will. That would be more of on the line of a business person. I'm more on the clinical side. Having said that, I'll try to find you some links that we can send out with this presentation, and hopefully that'll get you going down the right path.
All right. If we have a hospice provider that received a provider relief fund payment and was not negatively affected by the virus, will we have to pay back funds? We did not apply for the funds, they were just given to us.
Yes, I have not seen anything in writing about this. However, the general consensus is that you need to go out and read the terms of conditions, and if those apply to you and you attest yes, then you would not have to pay it back. If you read those and you realize no, this doesn't apply to me, then you would need to pay that back.
Okay.
So here again, that's the Provider Relief Fund, but I also have just a PDF of these acceptance of terms and conditions. So you don't have to go and click on everything. You can just read the PDF here, and then you'll know what you want to say when you go to actually attest. Personal preference, how you want to do it.
Okay, thank you. We've gotten a couple more questions around Medicaid for rural health providers and how they attest. So we will follow up with you separately on any information regarding that. What is interest on first money that needs paying back and when?
So I'm not sure what the interest is. I could find that out. As far as the when, it depends on the type of provider you are, and that is listed. I believe it's on this fact sheet. If not, it's definitely in this MLN Connects, the different types of providers and the time frames. But it's anywhere from 3 months to 2 years, roughly. And this is not where you really write them a check. They just withhold instead of, after the pandemic is over, then they start just holding your reimbursements until you're paid up, or a portion of them until you're paid up. So you'll get paid now, but then down the road, some other reimbursements will be withheld to pay for that.
Okay, thank you. We've gotten a few more questions around the Paycheck Protection Program. So just a reminder for everyone, this is more on the clinical side for providers. We can follow up with you separately and provide some information on the business related side. So we'll share that with you following today's webinar. A question came in, is the second payment only for care of COVID-19 patients?
Yes, well, not just care, it's for lost revenue and increased expenses. So care of patients is included in that, but there are other factors. So I believe the simple answer is it's COVID related, kind of end of story.
Okay. More questions related to the expenses. So what expenses are approved for spending these funds? Is there a time period for spending them?
So there again, what's approved is determined by your provider type. So we can send more information about that. So, for example, rural healthcare providers can use these to improve their broadband experience or speed, or buy tablets for the backdoor folks, so they can document outside, things like that. Or it could be patient care. So if it's something you did that you wouldn't have done except for COVID, then it would be included.
All right. Who all is eligible for this program?
All Part B providers and suppliers. So it's for medical devices as well as patient care, whatever services would be related.
All right, perfect. Let's see. We have a few more questions coming in. You do still have time to submit questions. If you have any additional ones, you can absolutely send those in.
I see one here that says how many, it was in line with the how many provider programs. And it says the stimulus was first there was 30 billion, and that was distributed between, let me look at my dates real quick, it was like 2 weeks in August, and it was out the door. Let me see. So the first 30 billion was distributed between April 10th and April 17th, and that was the accelerated payments program. Now there's another 20 billion being distributed right now. You probably already have it because it was as of last Friday. How that plays out is there was 100 billion allocated to healthcare, and 50 of that billion was for providers. So after this last 20 billion distribution, that 50 billion for providers, money directly to providers will have been exhausted. And then the other 50 billion of the 100 billion is to be used for things like preparing for a future pandemic, or expanding emergency resources, that kind of thing. It's outlined in the law. So I hope that answered his question.
Great, thank you. Another question came in here. Will FQHCs be qualified for the Provider Relief Fund?
Yes, they are, as long as they're a Part B provider.
All right. And let's see, what is the attestation? If you can provide some details around what all that entails.
So the attestation is things that was in a previous slide. Let me see which slide that was. So it's you'll need to submit data about your annual revenues and estimated COVID-related losses. So that's what you're attesting to, and then you agree to the terms of conditions. And here are the terms of conditions. They're 11 pages long. So you'll want to take some time to read through those. So it's basically, how much are you making? How much of that do you think is COVID related? And do you agree to these 11 pages of terms and conditions?
And is that included in our links slide, Margaret?
Yes.
Okay,
that
great.
Is this, next to the last link, I believe.
Great, we will include that. So it looks like that is actually all of our questions we have today. So we're going to end a little early. If there's any questions that we weren't able to get to, we actually had one more write-in really quickly. So all the terms are just for Medicare patients.
So the terms, so the payments are going to be determined and with paid back from your Medicare reimbursements. But whenever you submit your information, that would be your whole practice, because hopefully, ideally, you'd have a MAC that has some other payers that would kind of follow in line, and maybe they would be offering some kind of help or relief. I don't know that for a fact. I know that there's been talk about it. Obviously, I don't know all the MACs and payers for the whole country. So it's just something to check into. So when you report your annual revenue and your estimated expenses, that's your entire practice. When you are paying back the loan, that's just going to come from Medicare reimbursements.
All right, thank you. So yeah, we'll go ahead and conclude today's webinar. Just as a reminder, we will send out the recording to this as well as a copy of the presentation. So you'll have access to these sources and links for reference. If there are questions that we weren't able to address today, we will follow up with you in an email separately. I want to thank everyone for taking the time to join us today, and a special thanks to Margaret for presenting. I hope y'all have a great rest of your day and look forward to connecting with you all again soon. Thanks.
Thank you.